Hello and welcome to the total joint replacement video. We're going to talk about your upcoming total joint replacement at the Orthopedic Institute at Concord Hospital. The goal of this video is to prepare you and your caregivers for your upcoming total joint replacement. We're going to provide information about your hospital stay as well as care when you leave the hospital. We're hoping to relieve some anxiety and provide you with a smooth transition from hospital to home. It's very important to follow a nutritious diet before and after surgery. Your diet should consist of high protein, which is going to help with muscle healing. Examples include meat, dairy, eggs, and beans, as well as high calcium and vitamin D. That's going to help with bone healing. That's things like dairy, dark leafy green vegetables, fortified juices and cereals, and continue to follow any recommendations your doctor has given you. Bowel health and avoiding constipation. An unfortunate side effect of pain medicine is constipation. It's the #1 thing we hear after surgery. It's very important that you eat plenty of fiber, fruits and vegetables, and drink plenty of fluids. That should be 8 to 10 cups of non-alcoholic, non-caffeinated beverages a day. You'll want to include stool softeners and laxatives as needed. After surgery, make sure you take stool softeners or laxatives as you need them until you go to the bathroom. Don't wait too long because the longer you wait, the harder it gets. At this point, you've been to pre-surgical testing. They've given you a bag of pre-op drinks that you need to drink before having your surgery. These drinks are going to help your body have better nutrition so that you recover well from your surgery. Having surgery is like running a marathon, and you want to drink well and hydrate your body to prepare for the surgery. Before surgery, prepare your home ahead of time. Plan for your pets. If you have a big dog that needs to be walked, have somebody help you out with that animal while you're recovering from surgery. Remove anything that might get in your way of using your new assistive device. You're going to go home with a walker, cane, or crutches. You'll want to remove things like scatter rugs or cords that go across thresholds and any clutter that you might have around your house. This way you have clear paths to walk around your house and go from different rooms in your house. Ensure you have access to a phone in case you need to call for help. Night lights in the hallway can be helpful. This way you get up and you're using your new assistive device during the night and getting to the bathroom safely. Avoid low, soft furniture. If you have a couch that's low and soft and hard to get out of now, it's still going to be low and soft and hard to get out of when you go home. We want you getting up and moving after your surgery. You'll want to make sure that you put an extra cushion on the couch so that way you can get in and out with ease. Preparing for surgery. Remember to review your instructions given to you by pre-surgical testing once again when you get home. Make sure you take medications you're supposed to continue to take and stop any medications they've told you to stop. No eating or drinking after midnight. You will drink your pre-surgical drink in the morning as directed by pre-surgical testing. Skin preparation. Shower the evening before and the morning of surgery using the special soap provided for you. You're going to wash your hair and your face as you normally do, and then use the special soap from your neck down, scrubbing your whole body. Make sure to get into clean clothes after using the special soap. What to bring to the hospital. Pants, shorts, t-shirts, loose-fitting clothing that's comfortable for you. Bring walking shoes that fit well, such as a walking shoe or a sneaker. Crutches or a walker can be brought the day of discharge in case they need to be adjusted. If you use a CPAP or a rescue inhaler, bring those the day of surgery as well. And of course, your positive, motivated attitude. The day of your surgery, don't put on any lotions or makeup after you've washed with a special soap. Take off any jewelry, including your wedding bands or body jewelry. Leave valuables at home. Make sure to take any medications that you have been instructed to with a small sip of water the morning of surgery. You can park in either A or E lot the day of your surgery. There is someone at the hospitality desk that will direct you to the admitting care unit. In the admitting unit, you will meet your surgical liaison. She will update any family members and tell you about your surgical journey. You will also meet your AMU nurse. She's going to give you an IV and give you a little medication to help you relax. You will also see your surgeon and your anesthesiologist. Your surgeon will mark your surgical site and they will answer any final questions that you may have about your surgery. From AMU, you head to the operating room, otherwise known as the OR. You will be in good hands with our OR team while your joint gets replaced. From the OR, you will come out into the PACU. The PACU is called the Post-anesthesia care unit. This is where they wake you up and bring you out of anesthesia. They're going to monitor your blood pressure, your heart rhythm, body temperature, pain, as well as oxygen. The doctor will call and speak with a family member over the phone, or if they see them, they'll speak to them in person. Equipment you might notice when you wake up. You'll have IVs and IV fluid that's going to help flush anesthesia out of your system. You'll have an oxygen tube or mask that's also going to help wake you up out of anesthesia. You'll have a dressing over your incision, and you'll have sequential compression devices, otherwise known as SCDs, and anti-embolism stockings, otherwise known as TEDs. Once you are awake enough, you'll be transported to the Orthopedic Institute, otherwise known as 6 East. We're going to watch you closely and get vital signs for a couple hours. We will also wake you up overnight and get vital signs and assess you every 4 hours if you stay overnight. You'll use an incentive spirometry, pictured here, that will help keep your lungs clear after surgery. We're going to monitor your urine and make sure you don't retain. Diet. As you start to feel hungry, we'll feed you. We'll progress you to solid food as you tolerate. If you do have nausea, let your nurse know and we can give you medications to help ease it. We also offer aromatherapy. Pain management. We have oral and IV pain medicines available to help control your pain. Hips usually complain of a stretching feeling in the front of their thighs. Knees might start with tourniquet pain, which is around the thigh, and then as your knee wakes up from the block, it will start to feel like your knee hurts in the middle. This is our pain scale. You will rate your pain from 0 to 10. 0 is no pain at all, and 10 is as bad as you can possibly imagine. We will try and control your pain to below a 5 or a 6. Once it starts to feel uncomfortable and you are unable to concentrate on anything else, we'll want you to take pain medicine. You will have pain after surgery. Everybody's pain threshold is different. We'll make sure that we figure out how to control your pain and get it to a tolerable level before you leave the hospital. Managing pain after your orthopedic surgery is a multimodal approach. We'll try different things that range from ice and gentle activity, as well as elevation, and give you things like Tylenol and nonsteroidal anti-inflammatories. If your pain is still not controlled, we will use narcotics. We have different narcotics available to you, and we'll figure out what works for you. Once you come up to 6 East, we're going to start home planning for you. Some of you can go home the very same day of surgery, and some of you will stay overnight. The day of surgery, we're going to have you sit up on the edge of the bed and walk with staff. We're also going to give you education in a green envelope that goes over your pathway to recovery. You will have a private room after surgery. We have all private rooms as well as a whiteboard that'll be updated on a regular basis with your nurse's name and your plan of the day. You also have a private bathroom in your room. Your safety is our top priority. The hospital has a lot of tubes, wires, and cords. We need you to participate in keeping yourself safe. Never get up alone. Always ring for assistance. Never get up even off of the toilet without having staff present. Getting up alone can lead to serious injury, or result in another trip to the operating room. Use the call bells that we provide to you as well as the bathroom cord at all times. In the morning, we're going to get you up and have you mobilized to prevent stiffness. Sit up for all your meals and walk with the nursing staff. You will also work with therapy. Guests of patients should park in parking lot E. The visitor's entrance is where you will depart from. Equipment specific for total knee replacements include K-FAS or a cold pack. The K-FAS is a knee flexion assistive sling, and you will work with your nurse to bend up your knee and use the assistive sling. You will have a cold pack called a cryo cuff. This will go home with you, and you can use it to ice your knee. Total shoulder replacements will go home with an ultra sling. Occupational therapy will show you how to get dressed while using the ultra sling. Physical therapy will see you. They're going to make sure that if you need pain medicine prior to your session, that they work with your nurse. They're going to show you how to get in and out of the bed, in and out of the chair, and they will show you stretching and strengthening exercises. They're going to walk with you and decide what assistive device is best for you. They're also going to review the number of stairs that you have and make sure you can get up and down them safely prior to discharge. Occupational therapy. They practice safe transfers on and off the toilet, in and out of the tub, and in and out of the car. They're also going to make sure you're able to dress yourself and give you any dressing equipment that you might need. Some of these tools might include a sock aid, a long-handled sponge, long shoehorn, or a reacher or leash. These will be given to you here at the hospital if you need them. Equipment for home. If you can, borrow walking equipment from friends and family. Check with local loaner groups such as American Legions, VNAs, and churches. You usually don't need a walker very long after having surgery. The best choice is the walker here pictured in the right, 2 wheels in the front and straight legs in the back. That's what's most recommended. Some of you with good upper body strength can go home using crutches or a cane. If you have a total shoulder replacement, you might use a cane for additional balance support. Here is a list of different places you can borrow or buy walkers. Possible complications after surgery are the same as with any surgery. Possible complications can include blood clots. A sign of a blood clot could be swelling, redness, or pain in the calf. This would be something you'd want to call the doctor's office right away. If you have trouble breathing, that could indicate a blood clot in the lung. You'd want to call 911 or get to your local emergency department if you ever experience trouble breathing. We are going to work to prevent blood clots because we're going to have you walk as soon as possible. So you are also going to use anti-embolism stockings and SCDs. When you go home, you'll use anti-embolism stockings or TED stockings during the day, and you'll take them off at night for a few weeks following surgery. You're also going to be prescribed aspirin or warfarin therapy following surgery for 4 weeks. Your surgeon will decide what's best for you. If you are on an anticoagulant for something other than blood clot prevention, you'll go back on whatever anticoagulant you're taking prior to surgery. Infection. Signs of infection can include redness, swelling, or heat at the site. Redness and swelling and heat is normal right after surgery, but this will go away over time as your incision heals. If it were to increase after it's been healed a few weeks or a month after surgery, you're going to want to call your doctor's office right away. You also might experience increased pain, increased drainage, or fever or shaking chills. If those were to happen, you'd want to call the doctor's office right away. We're going to prevent infection. We do give you antibiotics during your surgery. We're also going to stress the importance of hand hygiene. Make sure you wash your hands when you go home. Have everybody around you washing their hands and practicing good hand hygiene, especially before changing your dressing. You will want to keep your incision covered. We will give you waterproof dressings that you will shower with, and they're good for 7 days. You're going to keep your incision covered, and you're going to leave it open to air once we tell you it's okay to leave open to air. Don't touch your incision. Don't pick it, don't poke it, don't pull skin glue off. Leave it alone and let it do its thing and flake off on its own. The day of discharge, you'll work in the gym. You're going to practice getting up and down the stairs, in and out of the car, and in and out of bed with therapy. Discharge criteria for the morning. The doctor will round and will make sure that you get a prescription for the pain medicine that's working for you in the hospital. We'll also tell you which medication to take to prevent blood clots. We'll write down your follow-up appointment, and we want you to have a ride ready to pick you up in the morning after you've met this criteria. Physical and occupational therapy will determine that you are safe to go home and you're able to get up and down the number of stairs you have, in and out of the car, and in and out of the tub for safety. The nurse is going to review instructions with you. She's going to talk about your incision care, activity, and pain medicine schedule. The care manager or social worker will set up any equipment needs that might have come along or any outpatient arrangements such as VNA or rehab facilities. Outpatient arrangements after having surgery varies from individual to individual. Some of you that had a total hip replacement may not need therapy. Your therapy may be to go home and walk, walk, walk. Shoulders. You will either start home or outpatient therapy immediately following your surgery, as discussed with your surgeon. Total knee replacements. You will need additional therapy after going home in order to get full range of motion back into that knee. Your surgeons would like you to go to outpatient therapy if you're able to. If needed, we can set up home patient therapy arrangements through a visiting nurses association. If it's determined you need home care services, the care manager will set it up for you while in the hospital. Home after surgery. Start preparing your home now so that you can go home safely after surgery. See who can help you when you get home. Prepare and freeze meals ahead of time, especially if you live alone. You want to be eating nice and healthy and have things prepared for you when you go home. If home care services were determined that you need them, then we will set them up for you and have them visit your home. Once you get home, make sure you take out your instructions once again and go over them. Continue to do your exercises as provided by physical therapy. Make sure you're taking your aspirin or warfarin per the doctor's orders. And walk, walk, walk. When you get up, you go to the bathroom, take an extra walk around your house. If it's nice outside, you can go and take a small walk outside. Walking is key to aid in your recovery. Supplies you might need when you go home is ice and hand sanitizer. We'd like you to have those nice clean hands after surgery. Skilled nursing facility. Most all of you are going to return home after surgery. Depending on your ability right now to mobilize, it might be determined that you need a little bit of rehabilitative care for a short time in a skilled nursing facility. A couple things have to happen if you were to go to a skilled nursing facility. It must be medically necessary. We will look to make sure that your insurance covers where you're going to go, and we have to get approval prior to you going there. Living alone is not an automatic qualifying factor. You guys do so well that most of the time you don't need an additional stay in a skilled nursing facility. If it is determined that you do need a stay in a skilled nursing facility, it will be short, and we will discuss with you options that are available to you based on your insurance and your needs after surgery. Here is additional contact information should you have any further questions. Thank you so much for watching this presentation, and we look forward to you joining us for your joint replacement at the Orthopedic Institute at Concord Hospital.